Hi guys, I want to talk a little bit about the irreversible damage that occurs to your tissues with liposuction when you have loose skin or need a tummy tuck, or later in life when your skin becomes loose. If you have liposuction, what happens frequently is that the surgeon will remove the tissue, and it's very difficult to remove that in an even layer, okay? Even above average surgeons will have a hard time removing an even layer because we're not machines. Therefore, you get thicker and thinner areas surrounded by scar or scar tissue, which is fibrosis. When there's excess skin, it will tighten a little bit based on the inherent properties of the skin, not because of any technology. And that will sort of lock it into a tight, scarred ball, kind of a wad of scar, for lack of a better term. So when you go back to seek options for revision surgery, you have to understand that it's very difficult to do additional liposuction because you can't get through that scar, and most of the time too much fat was removed. It's actually bad to remove too much fat in certain areas, like in the middle of your abdomen where everybody wants it removed. So all we can really do when we do a revision tummy tuck at that point is to try to get your skin as tight as possible, and then maybe to thin the thicker areas a little bit more. Sometimes we'll even inject fat, but it depends on the procedure we're doing, whether or not that can be done, depending on the space that's being created. So it's important to keep that in mind, because if you get liposuction, the result will never be the same after a tummy tuck, after you've had prior liposuction, especially the more aggressive and the more fibrosis that occurs. The worst situation occurs when they've removed all the fat and now your skin is adhered to your muscle underlying. That is the worst situation possible. Those will usually require some fat transfer first, and then an attempt at doing skin removal. No matter what, when you do the tummy tuck, the results are never as good. There's still irregularity. All you can do is get the skin as tight as possible. As a general rule, the tighter your skin, the less the skin contour irregularities that are obvious. So the key should always be to get your skin as tight as possible, which is why we almost always want to do some sort of skin removal with liposuction. That's why it's rarely used as a standalone procedure. Again, the results might look good for the first 3 months, 6 months, even a year. But after that, when the swelling goes down and the fibrosis starts to show, it's not going to look as good. If you have any laxity of your skin, it's going to look even worse. So keep that in mind. Make sure that you're seeing a true expert in body contouring. Don't just get a quick fix lipo that will leave you with problems for the rest of your life.